Arizona and across the nation, but very few right here in Fountain Hills and Scottsdale area. So we're here to have an open and honest discussion and exchange of ideas, possible solution about America's healthcare system and the direction it's headed. So before we begin, I'd like to ask that we keep this discussion polite. While each of our panelists are considered experts in their field, none of them have had any participation in the legislation that is currently being considered and debated on Capitol Hill. And please bear in mind that their participation in today's town hall should in no way be considered an endorsement of Eric's campaign. They are here because, like us, they share a concern about our health care. Now, our hope is that everybody who wishes to ask a question or make a comment has the chance to do so. So if you would, please write your question or comment down on the 3 by 5 card that you picked up at the registration table. If you didn't get one, if you raise your hand, then we'll have someone bring one over to you. And once you're done, thank you. Keep your hands raised, please, and make it come with me. And once you're done, write down your questions. We will have a volunteer come and pick them up from you. And we will do our best to get to everybody's questions, but we ask for your patience, and I think most importantly, for your respect for each other and for our panelists. So today we are honored to have a distinguished group of professionals here to speak with you about health care, free markets, about solutions, and about your concerns with Washington. And we do thank you very much for coming out on a beautiful Saturday morning. And now it's my honor to introduce you to a man that I am proud to be working with and someone I consider a friend. Ladies and gentlemen, please meet Eric Wnuck.
Good morning, and thank you for coming this morning. Again, my name is Eric Wnuck, and I am a candidate for U.S. Congress right here in Arizona's 5th Congressional District. However, today's not a campaign rally. Today is an open and honest discussion, an exchange of ideas, questions that you have that we may have answers for. I am a small business owner in the healthcare market, in the healthcare field. I am a proud father, a proud husband, and a Little League coach. I'm very happy that you joined us this morning for this discussion. I mentioned I own and operate freestanding diagnostic imaging centers. Raise a hand, anybody had MRI, CT, X-ray, ultrasound? Obviously, that's what I do. That's what I do. So I know a little something about bringing free market competition and efficiencies into healthcare at affordable prices. And I think that's very important. It's clearly in the opposite direction of which Harry Mitchell, Nancy Pelosi, and Democratic leaders wish to take us by spending $1.4 trillion in 2009 alone. Now we're talking about adding anywhere from $800 billion or $1.1 trillion more to a deficit. We're going to have a hard time paying. And I say to you, if you believe that the federal government is capable of taking over a healthcare system, I ask you to look at the post office or at the educational system. Both clearly are non-economical nor efficient. I believe free market principles are the way to change a healthcare plan that certainly needs reform. I have ideas on how to do that. I bring 6 principles with me, whether it's healthcare, economy, wherever we're at. First thing we have to do is your healthcare plan, any healthcare plan that's thought up in Washington, needs to focus on the patient. It needs to be patient-centered. It needs to revolve around you. That's the problem with the Baucus bill or H.R. 3200. It doesn't revolve around you. It revolves around the dollar that the federal government spends. It doesn't have your best interest at heart. It doesn't allow you to focus on what's important to you and the studies and the tests and the physicians that you wish to see. It has to have accountability and results. How can any healthcare program that's invented or created or come up with that now we're trying to implement not have accountability and results? Physicians need to respond to who? You, the patient. It ties right back to being patient-centered. It's about you. It's your healthcare. Your physician needs to respond to you. Your health insurance needs to respond to you. Your Medicaid, Medicare provider, the federal government needs to respond to you. It needs to be efficient. It needs to be efficient. There is $40 billion worth of Medicare fraud year to date alone. $40 billion. That's not efficient. If Medicare were managed better, we wouldn't be having this conversation. We'd be utilizing money the right way, making sure that Medicare recipients are being taken care of, not penalized.